Now, Christmas is the most wonderful time of the year. It's particularly one of my favorite holidays. And I know most of us are gearing up to travel if you're not already on the road. Now, how many of you would be comfortable driving that car if it was not serviced? If you didn't pass by the petrol station, open that hood and have them check if there's anything to be concerned about. So we wonder, why do we not pay the same attention to our bodies? Now, to have this discussion on wellness, because we need to look into our bodies before they start telling us that there's a problem. What are some of the things we need to look at that give us those signals or that sign that we need to check something, that we need to speed up something or slow down on other aspects? Now, to discuss this very interesting and timely topic is Dr. Catherine Gathu. She's a family physician that's based at the Aga Khan University Hospital. Karibu sana, Daktari.
Thank you.
We're indeed honored and pleasure to have you on the show today.
It's a pleasure too.
Now, our sponsors on the show today are the Aga Khan University Hospital, which is a center of excellence when it comes to matters healthcare. And they're telling us that at only 10,450 shillings, you can actually start your journey when it comes to wellness and checkups. Now, Daktari, I know some people, this is the first time they're hearing of a family physician. So could you just tell us a little bit about what that means? What is a family physician and what do you do on the day-to-day?
All right, thank you so much and good evening, everyone. So a family doctor is a specialist who's been trained to take care of the entire range of the family, like all ages, across common healthcare conditions and over time. Hence, we offer continuity of care within the context of families and the community. Yes, so we are also deemed as the gatekeepers to the healthcare system, and we are usually the first point of contact in terms of the doctors that you interact with anytime you go to the hospital. And we help patients navigate the healthcare system. So sometimes you get patients coming in, maybe they have a headache, a stomachache, they don't know where do they begin. They want a specialist.
And you don't know which one.
Exactly. So we are the doctors who help the patients with that.
Naam.
Yeah.
Kuna watu wanajiuliza, daktari, kwa nini niende hospitali kama mimi si mgonjwa? So pengine tuanze tukuguzia, kwa nini unataka tukuje hospitali hata wakati tuko sawa, tumeamka vizuri, lakini unasema kuja hospitali? Why do you want us in the hospital?
I think the most important reason is because some of the serious conditions that we face earlier on, they're quite silent. And they start very silently, but they progress also very slowly. So unless we go to hospital early to have this detected, we end up getting diagnosed with these conditions much later when they have started developing complications, and it's much harder to treat at that time. So the best time to actually seek the doctor is without any signs and symptoms, so that, as you have said, we just do a routine maintenance checkup to see whether there's something that could potentially maybe be treated earlier on before it develops into a complication. Yeah.
Now, there's a 25-year-old mwenye anatusikiza saa hizi anajiambia, mimi niko sawa, I'm still young.
Yeah.
Who needs this checkup? Ni umri gani ambapo tunafaa kusema sasa tunafaa kwanza kwenda kwa hospitali? When should we start these checkups? Na kuna tofauti gani? Tuseme mimi kama na miaka 50 na mwingine na miaka 20. What is the difference in how we are going to come in for these checkups?
Very good. Swali la muhimu zaidi. You remember, especially when we were children, or mothers who have had children, we routinely take our children for well baby clinic. Hiyo wakati mtoto anaenda, pengine anapewa chanjo, anapimwa uzito and all that. So swali muhimu ni kwa nini tuache? So hii ni jambo ambalo linafaa liendelee even after, when they're teenagers, when they are older. This is something that should be routine. So it should never it's not so much about starting. It should never stop from childhood, but what we do evolves with time. Unapata test ambazo tunaweza fanyia mtoto mchanga ni tofauti na vijana, ni tofauti na mtu mzima, na pia ni tofauti na the elderly people. So when you come, we have age and gender specific tests that we do based again on the different profile that you come with.
Okay.
Yeah.
So how often is someone supposed to come in for these tests? And when they come, tuseme kama bado niko nyumbani, nafaa kujitayarisha vipi nikijua kesho nataka kwenda check up? There are certain things I need to do, and then how often am I supposed to come in for these checkups?
All right. I'll begin with how often. Routinely we do it annually, but again it's very individualized. Hiyo ndio jambo moja naweza taka watazamaji waelewe. It's very individualized based on your risk and mazungumzo ambayo mtakuwa na daktari. daktari. The most important is a health checkup begins actually the day before. Daktari wako anaweza kukuelezea usile chakula kwa muda fulani, about 8 hours, so that you are able to have a more accurate assessment of some of the tests that we are going to do. Kisha baadaye ukifika hospitalini, you normally begin with dalili za muhimu za mwili, what we call vital signs. Unaanza na blood pressure, which is very important, mapigo ya moyo, the pulse, and then unaangaliwa pia joto na uzito wa mwili. All these are important because I don't know, Lorraine, if you know that 1 in 4 Kenyans is actually walking around with high blood pressure undiagnosed. And if it is undiagnosed, it is therefore not treated. Pia magonjwa hii, you know, obesity is a very high risk for chronic conditions like diabetes and hypertension. Therefore, that's why we begin with that. And even a random blood sugar, it's very important for us to check that. Immediately after that, then you move into a very important aspect of that assessment, which is the consultation with the doctor. This is where unaanza kuulizwa maswali, you know, whether you have any common conditions, whether you are taking any medication, your family history comes in there, social and lifestyle history. Ni jambo muhimu sana kama unatumia vileo, pombe, sigara, kama unafanya mazoezi, which is very important. We also do a brief mental health assessment because pia tunajua mambo ya hisia, mambo ya stress pia inachangia all this. Then after that, daktari atakutuma kufanyiwa laboratory check-up, ambayo tunapima some very common things, you know, damu, tunapima pengine figo, cholesterol, liver and other tests, na pia tunaweza hapo tunaongeza the test for cancer screening that are both age and gender specific. So that is how a routine check-up would look like for a patient.
So wakati mgonjwa amekuja sasa, amekuja mmezungumza, kuna tofauti unaweza sema kati ya pengine kuna yule mgonjwa tayari ana magonjwa fulani.
Yes.
Huyu ni mtu ambaye ana shinikizo la juu la damu ama ugonjwa wa sukari.
Yes.
Kuna tofauti in terms of hiyo frequency. Kuna vile utamwambia tofauti na yule ambaye hana chochote.
Very, very true. Kama mgonjwa kuna pengine magonjwa mengine kama blood pressure, kisukari pia, we tend to want to see them more often. Kwa sababu the frequency of the test that we need to do ni mara nyingi. Kama sasa ugonjwa wa figo, chronic kidney disease, inatokea mara kwa mara kwa wagonjwa ambao wekona shida ya pressure na pia shida ya sukari. So we tend to want them to see, we want to see them more often and do these checkups more regularly so that we can again prevent these complications. Pia wakati mwingine tunapofanya zile cancer za tests za kuscreen, tuseme pengine cervical cancer, kama ni wagonjwa ambao wekona ugonjwa wa HIV, we want to screen them more oftenly kuliko hawa wagonjwa wengine, kwa sababu tunaelewa kuwa because of their immune deficiency, haya magonjwa mengine yanaweza tokea more often than kwa perhaps the normal population.
Asante.
Yeah.
Now, please tell us, when was the last time you had a wellness check, or have you ever done any, and what did you find? Baada ya break tunataka kujua ni nini haswa tunatafuta. What are these tests we are doing na ni dalili zipi ambazo tunaangalia ili tujue kama kuna shida ambayo inaweza kuwa imeanza kuchemka mahali. So please talk to us on our SMS lines on 22422. Call us on our lines below and engage us on our socials. That's at Uliza Daktari and at Daktari_Mengesa. And welcome back. I am your host, Dr. Lauren Mengesa. Yani daktari wa kina mama. I'm an obstetrician and gynecologist based at Akira Care, that is at the Upper Hill Medical Center. And with me is Dr. Catherine Gathu, a family physician who's talking to us on matters wellness. Now, on to your questions today. So we're looking at different concerns that are coming from your end. Anasema, I'm 50 years old. Is it too late to start routine wellness checkup? Thanks for the program. Next question says, kindly, how much is a routine round of medical checkup? Another question that was from Vicky. Simon from Meru is asking, is there a single blood test for detecting all the cancers? Another question that says, for a common person, is it, it's not easy to have an ordinary visit to a hospital when not sick. When you do so, the medical staff is overwhelmed with a lot of work and then they're sent home. So what do we do? Now, we're going to take a call from Toroitich. Hello.
Hello.
Hello, habari ya Baringo?
Mzuri sana.
Karibu Uliza Daktari.
Mzuri.
Naam, swali lako?
Swali langu ni, nimekuwa na shida ya nini? pressure for long. Na yani imepersist.
Naam.
Na nimetumia Losartan H lakini ina reduce pressure mpaka inakuwa 99 out of 58. 99 out of 58. Sasa imefika mahali na feel your distance. So I don't know.
Unameka
na feel your pain sasa kwa kifua.
Naam. Tafadhali umri lako na umekuwa kwa dawa hizi kwa muda gani?
Nimetumia for 2 months.
2 months.
Yeah.
Aha. How old are you?
I'm 44.
Naam, asante kwa swali lako. Okay, daktari.
Yes.
So patients are saying, ama our viewers are saying, wanaogopa kwenda hospitali kama si wagonjwa. Wanaambiwa there's a lot of work, they're sent back home. Wengine wanataka kujua hizi tests. Kuna ile moja tukifanya unajua kila kitu inaendelea. So what are we checking? What are these tests? Wacha tuanze kama tuseme mfano ule ameulizia zile za cancer.
Very true. I think that's an important question. Na vile umeuliza, wakati mwingi unapata kama unaenda unaambiwa pengine urudi nyumbani, kuswali ni unaenda kwa daktari yupi. And that's why swali muhimu naweza taka kila ambaye anatutazama leo ajue ama pengine atafakari ni, do they have a family doctor? Everyone needs a family doctor. Ukija kwetu na utuambie hivyo, that's part of what we do. That's actually what we encourage you to do. So kwetu sisi ukija halitakuwa jambo la pengine ambalo sio la kawaida. It's something we actually encourage people to come when they are well. But really there's no one test that can detect all cancers. That's something that they should know. We normally for example, we normally do tests based on gender and also based on age. Kwa mfano tukianza na wanawake, tunaanza na, there are 2 main tests that we use, or there are 2 main screening modalities that we have for, there are 2 main cancers we check for. That's breast cancer and cervical cancer. The main reason we check for them ni kwa sababu prevalence. Tunapata kuwa wanawake wengi wanapata shida ya cervical cancer na breast cancer. So cervical cancer tunaanza utafiti at the age of 21. Na pia tunasema sexually active women from the age of 21, we are able to do the pap smear or the liquid cytology test. Na inatusaidia sana kugundua hizi cells kabla hazijakuwa cancer, and we can do something about that. Kwa in terms of breast cancer screening, from the age of 40 and above, we are able to do mammography. But even before that age, we encourage women to come and we are able to do a clinical breast examination. Hiyo pia inatusaidia sana kugundua this cancer when it is still very early, where we can do something about it. Men are not left behind. We mainly screen for prostate cancer, again based on prevalence. Tunapata ni wanaume wengi sana wanapata hii shida. Kuna mbinu tofauti, kuna ile ya damu, but it's not as accurate as a physical examination from the doctor, ambayo najua wanaume wengi hawaipendi
kusikia mambo haya, lakini ni lazima yazingatiwe.
Yes, it's actually a more accurate diagnostic or screening modality for that. And this is something that they should be going to the hospital and having a conversation with their family doctor about, because it's very important in terms of screening. Remember, we are screening so that in case we find it early, we can begin treatment early to prevent complications. And in some conditions, we can potentially cure them. So that's really why we are doing this screening.
So wanaume wanaambiwa lazima kuangaliwa njia ya nyuma ni muhimu.
Ni very, very
kuna mambo ambayo
important.
unaweza pata kwa clinical exam ambayo pengine hataonekana kwa damu.
100%, kweli kabisa.
Talk a bit about cancer zile za GIT, colon cancer and screening. Kwa wale ambao wana family history ya colon cancer and generally for wale ambao hawana.
Very, very true. So that's another screening that we do, because we also are seeing a lot of colon cancer. And the worst thing about cancers right now ni kama zimebadilika. Wakati mwingine zamani zilikuwa zinakuja to the elderly, older population, lakini kwa sasa tunaona hata watu miaka 30, miaka 40 wanapata hizi cancer. So routinely what we do kwa cancers of GIT ama colon cancer specifically, we do a stool examination. Hii test tunaita fecal occult blood test, or another one, it's a more modified native FIT test. And mainly what we are looking for is blood in stool. Damu ambayo hawezi ona ama kugundua kwa macho. So that's what we are looking for. Tukigundua kuna damu ama chembe kidogo, then daktari anaweza kuku-advise you go ahead and do a colonoscopy. Colonoscopy Colonoscopy ni kama unaingisha kamera njia ya haja kubwa ambayo it can detect something like polyps. Ukazipata mapema, they can actually lead to cancer in future. So zikapatikana mapema, matibabu yanaweza anzishwa na uweze kutibiwa na potentially prevent something like colon cancer. So it's very important. The key thing, ukienda kwa daktari, ukianza huu utafiti utaelezewa. Again, very important about the frequency. Tuseme kama kuna mtu kwa familia yenyu amepatikana na colon cancer for around, akiwa na miaka tuseme 40, wewe kama a first degree relative, pengine ni ndugu yako ama ni mzazi, itabidi uanze hiyo screening 10 years earlier, so that isikuje ikakufanyikia na wewe hivyo ukifika huo umri. So as you can see, we start with routine tests from around the age of 40 for those cancer screening, but in certain populations we want to start earlier based on their family history.
So daktari, tumeguzia mambo ya cancer. Na lakini kuna zile test zingine ambazo tunafanya kuangalia figo, kuangalia maini zinafanya jicho. Unaweza tuguzia which are these tests that you do? Na ni nini tunaita kama tuseme red flags ama nini utakuwa unatafuta? Pengine nikija unipime kama cholesterol. What are some of the tests we do? Alafu before you get into that, let's take a call. Hello. Hello. Hello, Mwanasiti, unatusikiza?
Habari.
Habari, wambaje?
Niko na swali.
Naam. Tupe swali lako.
Swali langu ni kuhusu bwanangu.
Naam.
Akona shida ya pressure for now 6 months.
Naomba upunguze sauti kwa runinga.
Sawa.
Naam, Mwanasiti, tuambie swali lako. Umesema ana pressure.
Ana pressure for 6 months, ameanza dawa ya pressure na kufikia sasa some 2 months ago amekuwa akipata ganzi kwa mkono. Mkono mmoja. So hiyo inaweza kuwa ni shida gani labda?
Naam, asante.
Asante.
Sawa. So daktari, mambo ya pressure, shinikizo la juu la damu naona linatokea kwa wingi.
It's a very common problem.
It's a very common problem. Naomba tumalize kuongelea test, alafu tutazingatia yale maswali mawili ambayo yalikuwa anaguzia. BPs.
Okay. Yes. So the most common test we do is what we call routine checkup. Tunaanza na test kama the full blood count, which we call the window to your body. Inatusaidia kujua zile cells za body kama the red blood cells ambazo zinasaidia kupeleka oxygen kwa mwili mzima. White blood cells ambazo zinatusaidia na kinga, platelets ambazo zinatusaidia na kuganda kwa damu. So that's a full blood count. That's a very, very important test that we should be doing routinely. Tumezungumzia kuhusu kidney function test, inatusaidia kujua afya ya figo. Pia tuna liver. The liver test pia inatusaidia kujua afya ya maini, very important. Tukiangazia mambo mengine, tuliongea kuhusu kisukari. Kuna test ya sukari, kuna test tofauti, kuna ile random blood sugar. Wakati mwingine pia mnaweza fanya more other tests like the HbA1c, pia kuangalia mambo ya sukari. Cholesterol is a very, very routine test ambayo naweza ambia watazamaji kama hamjaenda kwa daktari kupimwa, it's very important. Inachangia magonjwa kama ya stroke na heart attack, mshtuko wa roho. So it's very important to screen for that. Kuna number ambayo kapata total cholesterol of anything above 5.2. Na kuambia kuwa cholesterol kwa mwili iko juu sana. And LDL, which is the bad cholesterol, anywhere above 2.5. Pia hiyo iko kipimo or kiwango cha juu sana. We'd prefer if you had more of the protective cholesterol, HDL. Ni ile cholesterol ambayo inatusaidia ama ina protect, the organs. So that anywhere above 1.6, hiyo tunataka ikuwe juu na hizo zingine zikuwe chini. Na daktari wako atakuelezea even as you go on. Pia kuna test ambayo tunaita urinalysis. Unajua kwa test ya mkojo tu inatuelezea mambo mengi sana kuhusu mwili. So we like to also do that as a routine checkup. So those are some of the basic tests that we like to do. Lakini tulizungumzia kuhusu individualized. daktari anaweza kukuangalia ama kusikize, asikie kulingana na maelezo ambayo umempatia, anaweza taka kuongeza a few more tests which would be important. Wakati mwingine unaweza lia shida za bones, anakuambia fanya vitamin D, shida around the metabolic, kama uko na history ya thyroid anaongezea test zingine. So these are some of the tests daktari anaweza ongeza kulingana na your basic history utampatia.
Now you know the test you're supposed to do. Na ningependa kusisitiza, if you're planning on getting pregnant, kama unapanga kupata ujauzito, lazima pia uje ili mambo haya tuweze kuzingatia kabla ya kupata mimba, because it becomes very hard to try and solve some of these problems when you're already pregnant. So that's another special group of people that need to come for their checkup before conception. So we are going to look into your questions on the high blood pressure, so please stay tuned and join us after the break. Naam, Hasiti and Toroitich, I hope you're still tuned. We're about to get to your questions. Kulikuwa na mwenye aliuliza kama ana miaka 50. Is she too late to do screening? And the answer is no. If you're 50, please start. But it's better to start earlier. Lakini kama hujawahi anza, basi anza pale ulipo. Naam, daktari, maswali haya ya shinikizo la juu la damu, yani high blood pressure. Unaweza tupatia maelezo? Huyu anasema pressure yake inaenda chini na ameanza dawa juzi 2 months ago. Mwingine anasema kuna kule kuganda kwa mkono. Maybe unaweza wajibu kidogo tu pale.
Okay. I think the most important thing I'd like to advise them ni wako na daktari ambaye anawafuatilia kama family doctor ama daktari mwingine. It's very important once you begin treatment for this chronic condition, unakuwa na daktari kama your family doctor ambaye anakuona kila mara ili anakusaidia kucontrol, kwa sababu ukimeza dawa alafu uone pressure pengine inaenda chini, pengine your dawa is a bit too strong and it needs to be moderated, so that would be important. Pia ukimeza dawa upate kuna mmoja alisema anaganda mkono. We'd like to know, is it a complication of the condition itself, blood pressure, ama ni dawa ambayo anatumia? You cannot know that on your own without a doctor by your side. So the most important advice I can give to both of them, watafute daktari ambaye anaweza waona kwa muda mrefu to help them with the chronic management of these 2 conditions.
Naam, daktari, tumezungumzia tests mingi. Wengine wanazisikia kwa mara ya kwanza na wanauliza hizi tests ni pesa ngapi? Now, our sponsors on this show today is the Aga Khan University Hospital, and I know kuna zile packages ambazo mnazo special, you say in the main hospital na pia kwa outreach zenyu zote. Can you tell us a bit about these packages na gharama yao ni ipi?
All right. It's very important to know that it's never a waste of time to invest in your health. It's actually an investment. Lakini pale Aga Khan tunaanza, the cheapest package we have is about 10,450. And important to note, this is offered even in our outreach centers. Kumaanisha kuwa ukiona hospitali ya Aga Khan, the clinics near you, they are very likely to be offering this service. So all you need to do is go there and they can offer you this package. When you come to the main hospital and some of our executive clinics, the packages would differ. And again, tumesema haya yote nafanywa based on the patient. We are also able to individualize that package based on the patient. But from as low as 10,450, you can get a good wellness checkup.
So also to do this wherever you are. Si lazima usafiri uje jiji.
You don't have to.
Test. Ukiwa kule Kisii, Kisumu, wherever you are, you can do it.
You can do that.
And start the journey of getting awareness on
Very true, very true.
Daktari, we know that health and wellness is not just about tests and diseases. Bado kuna mambo uliguzia ukianza, mambo ya mental health, and also what is on your plate. Could you tell us a little bit about how mental health is also part of wellness na mambo ya nutrition pia?
Very true. Let me begin by the WHO definition of health. We define health as a complete well-being, physically, mentally, and socially, not just the mere absence of disease. Kuna wale wanafikiria kuwa nisipokuwa na dalili zozote niko sawa, lakini except that you come to the doctor and you ascertain that you really don't know whether you are healthy. And as you can see, WHO are able to address those different aspects: physical, mental, and social well-being. So all those are important. Ukija kwetu, we do a brief mental health screening. Tunaangalia hisia zako, emotions, stress stress. Unajua kuwa stress pia inachangia some of these other illnesses. Pia, how much are you sleeping? Because usipolala vizuri inaweza changia magonjwa mengine. So that's very important. And even as we offer our, personalized wellness packages and care, we are also able to advise patients on nutrition. Pia tulikuwa tumesema one of the assessments we do ni uzito wa mwili. We're able to take the weight, the height, and calculate a BMI. And based on that, we can give you a personalized, individualized, counseling around what you would need to do to address that. So we work alongside the nutritionist who can help you to support you with you on that journey towards getting better in that aspect of your health. Yeah.
Now, as we go into all the festivities and start planning and budgeting for the new year, Daktari, what is the one thing that you want our viewers to remember from this talk?
All right. The first thing is everyone needs a family doctor. Do you have one? That's what I want every viewer to know, because whether it's about the common conditions, whether it's about screening of this, the wellness checkups, all this is done within the docket of a family physician. So everyone needs to have one. And the second and most important thing is we need to normalize going to the doctor even when we are feeling well. It's okay to go and have a routine checkup because that in itself will help prevent and avert so many diseases that could potentially come our way.
Okay.
Yeah.
Thank you, Daktari. Now, if your plans for 2026 include having a baby, karibia kidogo nikwambie. Now, we have to make sure that we do our checkups before pregnancy. Mambo kama sukari. Kama una ugonjwa wa kisukari ama sukari yako iko juu, these are things we have to control because inaleta complications wakati wa mimba. Kama una shinikizo la juu la damu ama pressure yako imeanza kupanda, then we also need to control this before. Daktari ameguzia mambo ya kilo na BMI. Kama kilo yako iko juu, ni rahisi kuipunguza kabla ya kupata mimba badala ya kujaribu kwanza kwenda gym wakati una ujauzito tayari. Pia mambo ya cholesterol and all these things. Maana if you start a pregnancy when you have a condition or you're impending karibia kupata shida fulani, then ukiwa na mimba inakuwa ngumu sana kwetu na inaleta risk pia kwa yule mtoto ambaye bado hata hajajua mambo haya ya magonjwa. So as we go into the festive season, we are urging you to please think about your health and wellness. Let's put this in our plan for 2026. Now, a special thank you to our guest, Daktari. It was such a pleasure having you on the show, and to our sponsors on the show at the Aga Khan University Hospital. Now, we're wishing you a very, very Merry Christmas and a blessed festive season. Please, as you take care of yourselves and your loved ones, put your budget in your budget. Please make sure that you plan for your health. Thank you for watching, and see you next Sunday at 8 p.m.